Today we are going to talk about what is a whiplash injury and what are the symptoms of whiplash, and then what do we do in order to accelerate our recovery process and to treat. So whiplash is as some of us would know, that it normally happens in a car accident and then could happen in other sorts of injury as well. However, most commonly when we get into a motor vehicle accident where there is a sudden extension of the neck and then it goes forward, so it's a very quick fast back and forth of the neck that wasn't ready for. So when our body wasn't ready for a strong force like that, so it didn't get an ability to be able to anticipate this movement, hence it couldn't guard against this sort of a force, and everything got caught up. It got caught up with a surprise, and hence this increased reaction to that strong force on that neck, which leads to all of these issues. So certain different injuries that a person could sustain in a whiplash is some muscle sprain and a strain, ligament injuries. Ligament are the small little soft tissue which connects a bone to a bone. So when those ligaments are being hurt, now the joint becomes a little unstable, and all the soft tissue around that area, if they've been overstretched and then torn, then it could lead to weakness in that area. And then sometimes in major cases, there could be a disc that could be hurt and become sensitized and could cause pressing or sensitization of a nerve. It could hit on a nerve, and which could cause some pain going down our arms as well. And whiplash doesn't necessarily stays just around the neck. It could actually accelerate to our mid-back area and then has an impact over the lower back and the entire spine as well. But today we're going to talk about whiplash mostly staying around the neck area. So some of the symptoms that you could experience, and sometimes one important interesting thing about whiplash is that during that specific time, the body is going through such a shock that it may not realize the exact extent of injury at that time. So what you feel in the first 24 hours is not what you may be feeling after the first 24 hours. So people at times may not experience a lot of pain or discomfort at that time because there's a lot of other things that's just going through the body. However, when the body's metabolism starts settling down, and that's when the pain starts becoming a lot more localized and a lot more pronounced, and where you know that where exactly you're feeling all these discomfort. But neck pain, stiffness, muscle spasm, tightness, inability to move the neck, headaches, dizziness, and then sometimes pins and needle tingling, numbness, heaviness, burning sensation in the arm, pain all around the neck and then the upper back, not being able to focus, but then certain areas being super tender than another. These are the symptoms that usually goes with a whiplash injury. Now, two schools of thought. Back in the days, old school, people used to be advised about using a neck collar or try and rest as much as possible and avoid any movement. As much as these interventions may feel better at that time being, of course you're going to feel a little good because you're not moving and doing anything. However, evidence has suggested that such kind of intervention has delayed the recovery and then takes a lot longer time for people to be able to get back to their normal activity, as opposed to an active approach. Active approach doesn't mean that you push through the pain and then go out there and then move your neck or use your body aggressively, but the idea is to stay active as much as possible. Try and do some minimal movements of that neck, whatever is allowable in terms of if you have the ability to be able to move here and after that you feel the discomfort, then you should be doing that movement, and not just once or twice a day for a few seconds, but then throughout the day. The more repetition that you put in, the better it is. Of course, every injury is different, and then you're advised by a clinician based on the assessment. However, the general advice is to be able to try and find a way to stay active. That means going out for a walk if you're able to tolerate, or be able to do activities or hobbies that you are mostly involved in that doesn't put a lot of strenuous activity that could cause strain on the body. And then the more advanced or aggressive form of injury that you may tend to get with a whiplash is concussion, which is a lot larger topic at length. However, you may experience nausea, vomiting, brain fog, tiredness with your cognitive functions. That means ability to focus, ability to read, ability to react to the light, irritability to the sound, and blurry vision, and then more pronounced form of being ability to walk and then being able to track different objects. And once you are educated about these symptoms and communicate this with your clinician, then there is a good treatment intervention that could be provided to that. Most important thing, when you are dealing with an injury like this, the sooner you get help, the better it is to be able to get back to your regular day-to-day life.